Welcome to Hyperbaric Living Podcast. I'm your host, Dr.Masha. Today I have with me Tina Braddock. She's an integrative nurse. She served in military. 3.5 years ago, her husband was involved in really bad accident. He suffered traumatic brain injury, and she was told that he was not going to live. Today, she'll tell us her story, and it's a hyperbaric story. And we'll talk about her mission. We'll talk about the clinic that they're about to open. Welcome to the show, Tina.
Thank you so much for having me, Dr. Masha.
It's an amazing story, Tina. Can you please share with us your husband's story?
It was actually 3.5 years ago, June 12th, 2019. I was the lead trauma nurse at the local trauma center, the military trauma center. And I was sleeping during the day. I was working night shift, and I woke up to a phone call that one never wants to get. And it was to get to the hospital for my husband. Severe traumatic brain injury, 7 weeks in the neuro-intensive care unit, pronounced in a vegetative state with 0.01% chance of survival. I understood the science as a nurse. I get that he wasn't supposed to live, but there was something that really pushed me to hang on, and he fought like heck to hang on continuously for 6+ months in the hospital setting. And 15+ years ago, when I was in nursing school, I wrote a paper on hyperbarics for traumatic brain injuries. It was an up and coming practice. We needed a research article, and this was an interest of mine while in nursing school. So it was always in the back of my mind, he needed to get into a hyperbaric oxygen chamber. However, it was not accessible, not in the ICU setting, not in the 6-month hospital stay, and not in the rehabilitation in or outpatient setting. But TBI is considered to be a debilitating lifelong illness that's catastrophic, and the needs are ongoing for the rest of the person's and the family's lives. And it's been a tremendous jigsaw puzzle of just ongoing. And where do we go? What can we do? How do we optimize the brain was continuously in the back of my brain. In my mind, I was like, what can we do from the ER ICU setting? Like, we could have been doing more. As a trauma nurse, I felt, they saved his life, but it was also, why aren't we optimizing the gut-brain connection, optimizing his whole being? This was a human being, and at times he was not treated as one. And it's just, I feel there's so much more we can be doing for patients who are humans and TBI victims.
Tina, let's go back to that unfortunate day when you received the phone call. So you rushed to the hospital, and what diagnosis was worded? What did you hear there?
Yeah. As trauma nurse, immediately, I understood the language in the trauma room, and I heard them say DAI, which I immediately said, "Did you say DAI? No, this can't be. It's one of the worst catastrophic head injuries you can sustain, a diffuse axonal injury, which can't be confirmed until an MRI, which he was so unstable we couldn't get one for weeks. But a couple weeks in, when we did indeed finally get an MRI, which he was barely stable for that 15-20 minute process, it was a grade 3 diffuse axonal injury, which is the most severe. So 90% of diffuse axonal injuries do not survive. And of those 10% that survive, 90% of those remain in a vegetative state, which leaves Jimmy at 0.01% chance of survival.
And I remember that you mentioned that you never, ever in your life had it so clear in your head that you should persevere and you should continue fighting for him. Is that true? Like, how did it feel? Like, what did you feel?
I mean, I feel it right now, as you just said, that it's chilling. It really is. There's something beyond the science. There's something beyond there, a gut feeling. We can call it a source, a God, whatever it is, but there was something. He should not have lived. We've all seen this photo and the statistics, and it's a miracle. Yes. Yes. But, and there's this knowing. It was so clear that he needs to be here.
And
And
and that and you started fighting for him.
I understood the CAT scans. I understood the sepsis, the lab values all out of whack. I understood how bad the prognosis was.
And yet you can, yeah, it gives me chills as well. It's so powerful. So at what point in time was hyperbarics introduced?
Not soon enough. From the moment he was in the ER, actually, I think I did ask in the ER setting, but what if there was some sort of mild hyperbaric that would be, appropriate in this type of situation in the trauma room? I really believe these modalities need to be implemented immediately with, certain ischemic strokes in the ER. Like there's this window, this time frame. Time is brain. Why aren't we optimizing, not just preventing, not just reversing, trying to reverse and treat, but really enhancing and optimizing? This should be the focus. We know barely anything about the brain. I'm so excited about what's coming out about neuroplasticity and hyperbarics and neurogenesis and literally neural tissue being able to grow. This is profound for Alzheimer's, dementia, neurological disease, MS, TBI. This is exciting. So it needs to be shouted.
I hear it over and over and over again from doctors and even clinic owners. I just recorded a podcast, I think a couple of days ago. A guy, he's not a doctor, he's a clinic owner, but he's treated thousands of patients. It's in a hospital setting. And they all say the same thing. The sooner we get them, the better. The sooner I can get them, the better. So yeah, I agree. Hyperbarics should be started much earlier in the course of a treatment. We usually get to it when we've tried so many other things. They didn't work. As with TBI, it has to be a complex treatment protocol, and hyperbarics should be part of it. And in so many cases, it's not. And they could accelerate healing. So when hyperbarics was started and you saw improvement right away, right?
It took too long. It was about a year and a half post accident, which is too long. We finally got to Core Therapies in New Jersey, Dr. Sonner's practice, which I just locally looked up. Where's the nearest hyperbaric near me? He was at a rehab nearby, outpatient. And we immediately said, when can we get him started? And it wasn't immediate. They were really cautious and great with assessing and making sure that he was a candidate. And it was really, really well done. And I felt super safe, and being able to have my loved one in there who just went through so much was really important to me, knowing he was, in really good hands and the chambers were safe. And Jimmy is still learning to walk, still learning to talk, but every single day, thanks to hyperbaric oxygen, we see improvements. Within the first week of him using it, he reported his dreams returned. He hadn't had a dream in over 2 years. To me, that was profound. That was absolutely unbelievable. It brought tears to our eyes. And then a couple of weeks after that, his facial paralysis began he smiled. He came out of the chamber with a huge smile, and he was laughing. And I was like, freeze right there. Let me get a photo. I can't believe this. And every week and month since starting hyperbaric, we've seen changes constantly.
He's been receiving hyperbaric treatments for almost 2 years now. What changes have you noticed since he started therapy?
Within the first week was the dreams. It wasn't anything coming directly out of the chamber, but he woke up from sleep and again, a smile on his face. And he said, I had a dream last night. So that was profound. We definitely knew something was happening there. That was about a week to 10 days in. And then digestion. We didn't realize that the hospital setting and living in a transitional living facility, well, we did know that the food, is not that great. We did try to implement stuff, throughout his inpatient, outpatient rehab stay, better nutrition, brain health targeting, high in omegas, and just anything we could to boost his immunity and overall brain health. But he was very bloated, and we found out he had trauma-induced Crohn's disease on top of his, lots of TBI, but then the secondary and tertiary effects that come with that, which there was a laundry list. So yeah, another thing we had to tackle. So that was thanks to core therapies, we were able to get his functional lab tests and find that out and really start tackling his gut health, which, that was it was a blow. We were ready to get in the chamber and it was, let's tackle your gut inflammation and all this stuff that's now also impacting because it's connected. And, we understood that and we were trying our best at that point, but it was, a year plus at that point of hospital food and traveling and just really uneasy on the system, tube feeds. So we had to tackle that as well.
Do you remember what hyperbaric protocol did they use at core therapies?
So I believe we stayed at 1.5 for a while, and then we did try a 1.75, 1.5, and an up and down protocol for a little bit, which we are, curious about more protocols, and we would like to explore that. But we are very cautious, and we do things really slowly, and so far there's been no negative. He craves it. And we do see an immediate difference when he doesn't have it for a couple days.
Were they using supplemental oxygen? Like, was he doing it with a mask, with a hood, or with a mask?
With a face mask, yeah.
With a face mask?
In the hard chamber.
In a hard chamber.
Yeah.
Yeah.
And now we use 1.3 at home, which we see it. He goes in it as much as he can, a couple days a week.
Is he able to get in and out of chamber by himself, or do you need to
No.
help him? You need to
No. We use a good amount of assistance, at least one person. We have a standing pole. It's really safe, and it's good mechanics for him. We don't have it lifted or anything, so getting him in and out is a challenge. But
what chamber do you have?
The Viterra.
It's a Viterra, yeah.
Yeah, he struggles, but he requests it. It's a big part of our regimen. It's a lot of work and commitment and time, but he's in it for the long haul. We understand it works at the cellular level and it's slow, subtle changes over time. And we're really targeting the whole thing. So, Jimmy is just one of many. There's 176 traumatic brain injuries, related deaths every single day. And this is just not okay, that they don't have access to hyperbaric before. So,
and this is your mission, right?
Absolutely.
Is to make hyperbarics available,
accessible.
Yeah, accessible.
From the trauma room through the acute to the chronic to the ongoing to optimizing your wellness. This is an essential tool in the toolkit. We do a lot. You're right. There's so many things integrative to optimize, and we should have access. And oxygen under pressure is one that can really save lives.
I truly think that we're so good as conventional medicine with stabilizing people. When we get acute injuries, acute situations, we can stabilize them, we can save lives. But conventional medicine is not that good at treating chronic disease because all they do is they prescribe medication, but they don't treat the root cause, and they just stack medication over medication that produce side effects, and then they start treating side effects. So there is a huge place for all these natural therapies, and hyperbaric oxygen is absolutely natural. It's oxygen and pressure that can do wonders and that can change people's health. And when we have healthier people, we have a better world.
Right. And I think a lot of it, like, with my background, I really want to stress to my colleagues in the ER and the ICU and the hospital setting, knowing that there's these options out there for their patients and themselves. I think a lot of we need to stress the healthcare workers and the essential workers need these modalities. I think everybody's getting sicker. It's really scary. I'm trying to tell a lot of my doctor friends, I'm like, you guys got to get in the chamber. It's essential. If they're not going into work with their mind clear and with a good night's sleep and their gut health in check, how are they gonna go give optimal care to all these patients? And so that's what I think the real problem is. Let's, support each other and educate and really share how amazing this could be for not just their patients, but them and their family members.
Absolutely. And this is what Hyperbaric Living is about. We share information, we bring awareness, and we hope that more people will learn about hyperbaric oxygen therapy and will start using it. and we'll start getting better. Ask your doctors, ask your practitioners. Don't be afraid, guys, when you go and see your doctor and you've heard that there is hyperbaric oxygen therapy that can help. Demand that your practitioner at least does some research and see if it's the therapy that can help. And if they refuse, well, maybe it's time, to look for another practitioner who'd be willing to do work for you.
We are really excited to share that we are going to be opening a clinic in Hawaii for integrative medicine on the North Shore of Hawaii, Oahu, the Mana Warrior Collective. And we're also sharing hyperbaric oxygen chambers on the island through Hawaii Hyperbarics. So please check us out and stay tuned for updates. But we're very excited and we hope to share it with the world. It's necessary medicine.
Guys, all information about Hawaii Hyperbarics and all resources that we mentioned during this podcast will be in the podcast description or video description below. If you think that this episode can benefit someone, please share it with them. Please give us likes because it helps for other people to see this content. And if you really like this episode, don't forget to subscribe to our channel to receive more interviews and videos about hyperbaric oxygen therapy. And I'll see you next week.